Nella malattia di Crohn è importante anche gestire la diarrea da acidi biliari. Quando è che si verifica, cosa si intende e cosa abbiamo oggi per gestirla? Se ne parla durante l'8ª edizione del corso avanzato sulle nuove sfide nella gestione delle malattie infiammatorie croniche intestinali dal pediatrico all'adulto, e noi facciamo il punto con un vero esperto internazionale, il professor Jordi Guardiola. Professor Guardiola, what is the role of bile acid diarrhea in Crohn diseases?
Bile acid diarrhea in Crohn's disease. And at the beginning, I explained what is bile acid diarrhea. That in fact is a disorder of the metabolism of bile acid that produce a diarrhea when an excess of bile acid reaches the colon, and is a very common condition. It occurs in many patients with chronic diarrhea, particularly in patients supposed to have irritable bowel syndrome with predominance of diarrhea. At least 1/3 of these patients, in fact, they have bile acid diarrhea. And in other situations, it's also frequent, such in also 1/3 of patients with microscopic colitis also have bile acid diarrhea. And this is important to take into account, particularly in patients not doing well with budesonide or the conventional treatment. But when it comes to inflammatory bowel disease, it's also important to take into account the possibility that the patient has bile acid diarrhea, particularly in patients in which there is no evidence of ongoing inflammation. And this is quite common. In Crohn's disease, there is a clear disconnect between the symptoms and inflammation. And in both sides, there are many patients with severe lesions in the bowel that are asymptomatic, and other patients without lesions in the bowel who have symptoms. And it's important to recognize this, that the cause of these symptoms in some cases may be bile acid diarrhea, in order to avoid unnecessary immunosuppressive anti-inflammatory treatments. And in fact, several studies have demonstrated that at least 1/3 of the patients with Crohn's disease, even in clinical remission, that continue to have diarrhea, have bile acid diarrhea. When patients, if we talk about patients who had ileocecal resection, then the possibility that if they have diarrhea, the possibility that that diarrhea is secondary to bile acid diarrhea is very, very high.
Are you treatment for this
Yes,
patient?
and it's important to recognize this disorder because there are specific treatment for this condition that are the bile acid binders, such as cholestyramine or cholestipol, that usually work well, but unfortunately are often not well tolerated. So there are a proportion of patients that cannot tolerate these drugs. And very recent data suggest that the new GLP-1 receptor agonist may help in patients with bile acid diarrhea. But this is very preliminary data, but it may be an option for these patients that cannot tolerate the usual bile acid sequestrants. But it's a condition. It's important to take into account this possibility because it's still now very often overlooked and underdiagnosed and undertreated. And often we see patients that have been suffering for diarrhea during years without an apparent cause detectable, and they have this condition that we have to think about it.